I'm Melanie and I have OCD. Today I'm going to be teaching you a few recipes for OCD awareness. I'm going to refer to my recipe box. For our first recipe, a lesser known type of OCD called Scrupulosity OCD. For this, we'll need some obsessions. Obsessions are upsetting thoughts, images, or impulses that happen over and over against the person's will. I've got the devil here because some people with Scrupulosity OCD are afraid of committing a sin and going to hell, which is why we're adding the devil. Other people with Scrupulosity OCD are afraid to do something morally wrong, like committing a crime and going to jail, which is why we'll add in some handcuffs. A key feature of OCD is doubt. Doubting whether or not they're going to do something wrong that'll send them to hell or to jail. So we'll add in that doubt. Another important ingredient is compulsions. Compulsions are repetitive thoughts or behaviors to try to reduce the distress. So I've got the compulsions here. With Scrupulosity OCD, the compulsion could be repetitive praying, or it could be asking for reassurance that the person is a moral person. So I'll mix that up. And now I'm going to swap out these ingredients because I'd like to teach you about another lesser known type of OCD called harm OCD. So I'll swap out my things over here as well. Now there are different types of harm OCD. I'm going to feature a type called hit and run OCD, where the person is afraid that they'll accidentally hit somebody while driving, which is why we've got a car. We'll put the car in. So the person knows that if they truly did hit somebody, they would stop, but the OCD makes them doubt. Or they may be afraid that they'll purposely harm somebody, such as stabbing them with a knife. So again, they know that they wouldn't actually stab that person, but that ingredient of doubt takes over. So we'll throw in some doubt. We also want to make sure that we again add some compulsions. So compulsions for hit and run OCD could be checking the rear view mirror to make sure that they didn't hit somebody. And when it comes to the fear of stabbing somebody, they might ask for reassurance that they wouldn't do something like that. So we'll mix that up. And once again, I'm going to swap out my ingredients because lucky for you guys, I also have the recipe for treatment. So I'll pull out the recipe card for exposure and response prevention. I've got my main ingredient here, which is courage. So exposure and response prevention is exposing oneself to the scary situation and preventing the response, that compulsion. This is scary. So we want to make sure we add in a lot of courage. An example of this type of treatment with harm OCD would be holding a knife in front of a loved one to really show that person that they won't stab their loved one. And because this is really scary, we may as well dump in all that courage. So we'll stir that up. And now it's your turn to be a chef by going to the International OCD Foundation's website at ocfoundation.org. With hit and run OCD, the person might repeatedly check in their mirror view. I'm going to refer to my recipe box to pull out accidentally hit somebody while driving. So we'll put the car in the recipe bowl. The recipe bowl.